Richland County Community and Health Services Standing Committee to order. Can we have a roll call, Miranda?
Miller. Here. Brewer. Kramer. Here. Glassbrenner.
Here.
Harwick. Here. McGuire. Barris. Brathwaite.
Here.
And Schicker. Here.
Great, thank you.
You have 6 minutes.
Meeting was properly posted.
Yes.
Okay. Do I have a motion for approval of our 12-point agenda?
I still move.
Thank you, Ms. Chicker.
I will.
Second, Ms. Kramer. All those in favor, please say aye.
Aye.
Any opposed? Okay, does anybody have any changes or corrections to make to our minutes from July? If not, we'll declare those approved and move on to number 6, which is public comment. Is there anyone here or online from the public who wishes to speak? Hi, Marty.
I'm here.
Okay, if no comments from the public, we'll move on to number 7, reports. A is HHS Director Administrative Report and CHIP Overview.
All right, so I will start with my report. In the packet is our updates from the different units. A couple of things I just want to highlight. Number 1, in our economic support unit, Becky Dahlberg is retiring tomorrow. She has been with the county for 39 years, so we do appreciate her years of dedicated service to the county. That's a long time to be with one employer, so we do appreciate her. In our children and youth services, we do have one open position. It's been open for quite a while. And so we are hoping to get some applicants, but we're really struggling with that one. It is a position for a social worker. In child and youth services, we are also having a YES fundraiser. The YES program is our summer program with children. It really teaches them life skills. They do some community service. And it thrives on community engagement and reform building. So we are having a fundraiser on August 15th. It will be in the parking lot of the Community Services Building. They're going to have a brat hot dog sale and a car wash. So if you are interested in that, you can come on over. We were able to hire a mental health therapist. So last month, you guys approved a contract for a mental health therapist. Since that time, we did have somebody apply and she is starting on the 26th. So we're very, very excited. That will be a great cost savings to us. Any questions on those updates?
What's the date of the next one?
The 15th. I believe it's from 11 to 1.
And I just wanted to make a comment with Becky. We're planning on sending forward a resolution to honor her years of service for the county.
And then we, one of the things that have been asked is to provide a CHIP overview. So that is our community health improvement plan, and Evan Ewing from our public health unit is here to give that presentation, and he does have that PowerPoint that was provided.
Morning, everyone. I think it should be good to go. Okay. All right. So my name's Evan Ewing. I'm a public health specialist with Richland County Health and Human Services. And one of my responsibilities is to facilitate the implementation of our community health improvement plan. So I will be giving kind of an overview and then just some updates on progress that we've made so far. So all right. So for those of you that may not be familiar with some of the terminology, when we say CHIP, it's the Community Health Improvement Plan, and then we refer to CHA, that's the Community Health Assessment, and so that would be abbreviated CHA. The CHIP and CHA are delivered kind of simultaneously every 3 or 5 years, and that's a requirement for local health departments to provide that for the community as part of to maintain our accreditation. So our CHIP is guided by data that we collect during our CHA. We administered a community health assessment to about 266 community residents. And so some of you may be familiar with that work. And then based on that data, we identified 2 priority areas to focus our community health improvement efforts. And those priority areas were substance misuse and mental health. And so wanted to just provide kind of a general overview of some of the goals and objectives. Our overarching goal for mental health is to improve the mental health of Richland County adults. And we have 2 long-term objectives that we're focused on. And sort of our benchmark for those is the community health assessment and then also the county health rankings and roadmaps. They have data that they collect. And so those are kind of our benchmarks. And so you can see those off to the left there, reducing the number of respondents who report they face mental health challenges, and then reducing the number of poor mental health days that are reported by Richland County residents. And so looking at some of those causal factors, access to mental health services or lack thereof is an issue that kind of contributes to poor mental health, and then stigma. And so we'll see stigma both with mental health and substance misuse. We can go on to substance misuse, please. And then for this one, reducing binge drinking among Richland County adults. So there's lots of substances that could be used or misused, and we're targeting alcohol with all of our interventions. So our long-term objectives for those are to reduce the number of emergency room visits due to alcohol, and then reducing the number of county residents who report binge drinking in the past 30 days. And so some of the causal factors for this would be community norms. So that permissive drinking culture that's quite prevalent in Wisconsin, as well as stigma for this one. So stigma kind of surrounding seeking out help and resources. Our local condition for this would be that binge drinking is occurring where children's activities are happening. And so we're trying to promote other events and kind of reduce the number of events that serve alcohol where children are present. So just to provide an update on our efforts so far, back in May, towards the end of May, we did a CHIP implementation kickoff meeting. And this was held at the Richland County Health and Human Services building. We had about 14 members in attendance, 2 virtual and the rest were in person. And that meeting consisted of reviewing our CHIP priorities, goals and objectives, and some of the data within the community health assessments. We wanted to spend a good portion of the meeting discussing stigma. So what are some of the causes of stigma in the community? And then what are some ideas or ways that we could address that? And we had a lot of representatives from different sectors within the community present. So we had a good discussion around that. So some of the causes that people mentioned in the meeting would be kind of a small town. So that culture of kind of everyone knows everyone. And so that people may not seek out services with fear of having someone that they know their personal matters. Another person mentioned kind of like cliques within the town in terms of people feeling judged. If someone was new to the area, they may not feel like they were supported in seeking out services or help. And then also employers may not offer supports for their staff. So we know that some of the larger employers offer employee assistance programs, but we're not certain if small businesses offer those. So that was an area that was kind of interest. And I'll talk about that a little bit here as well coming up. Some ways to help with stigma that were brought up. Linda Stadler works at the Richland Hospital, and so she had brought up mental health first aid, which is a program that her as well as 2 other nurses they went and got the training for that. And essentially it helps you recognize if somebody needs help when they're dealing with different mental health issues. So in the actual manual, it would list off a condition like anxiety disorder, and then it would give tips on how you could help somebody if they were experiencing that and if you're not a therapist. So they're delivering small, short presentations to units in the hospital, like the med surg nurses and the ICU nurses. So that was an area I think strategy that I think could be quite useful. And then we also talked about the lived experience survey results. So I created an anonymous survey using Google Forms that anyone could fill out if they were experiencing mental health challenges or substance misuse issues. And they could fill it out anonymously, and it would provide us input that we could use in our implementation, so that we're actually receiving input from real people who are struggling with these issues. And within the results, they kind of backed up some of the things that were said within our meeting as well, the small town and that culture of kind of people finding out your personal matters. They had mentioned that their employer was not very supportive, and they knew that they needed to make a change, and they were essentially binge drinking to kind of block out some of the mental health challenges that they were facing. So it really showed us as a group that connection between mental health and substance misuse. And then we talked about our work group structure moving forward. So that all took place at our kickoff meeting. We can go to the next slide, please. And so after the meeting, we have our 2 separate work groups, and this is how we're going to implement our CHIP. And the substance misuse work group, we actually were able to partner with the Partners for Prevention Coalition's alcohol work group. So they have a subset group within their coalition that focuses primarily on alcohol. And I drafted an MOU to outline some of the expectations between our CHIP work group and the Partners for Prevention alcohol work group, just to make sure that we're all on the same page as we begin our collaborative. And as a collaborative group, we met twice, one time in June and one time in July. And so back in June, I presented some signage to the Boaz Village Board. I actually have some of the signs here. Kate Waterfall, a student at the high school, created these signs. And basically just to promote alcohol best practices, alcohol service best practices. So the sign just says person must be 21 years old to purchase alcohol, born on or before today's date in 2003. Another one that we have here is just saying that we check all IDs, we will not serve to minors. So that was a good one as well. And then the other one, this is a warning, no person shall sell or give away any beverages to any person under 21 or visibly intoxicated. And so that visibly intoxicated part of that sign relates more to the work that we're doing with the CHIP targeting adults, so that people aren't over serving at those events. And they were very receptive to those signs. And I didn't attend the Boaz Fun Days, but I do believe that these signs were posted there as they indicated that they were going to do so. So that was a win for our group, just them being receptive to those signs and kind of getting on board with that. And then we also are working to distribute festival toolkits to local event organizers. So this is an example of what that toolkit would look like. And within there's just best practices for alcohol service and just making sure that youth are not able to access alcohol and that adults are not overserved. And then we're also heavily promoting the National Night Out, which is an alcohol-free event, family focused, and that's next week on Tuesday. We can go to the next slide. And then our mental health work group is also, this is a new group, so we're not in a collaborative for this one. And we've met twice as well, one time in June, one time in July. And sort of to kind of piggyback off of our CHIP implementation kickoff meeting, I created some mental health business surveys. So the goal of these was to really obtain information from business owners, or in the case of a larger business, maybe from a manager that directly manages that site, and really just get information about what resources are they providing to their staff for mental health. It was suggested to have the questions designed in a way that would sort of eliminate cognitive dissonance. So if essentially, does the organization's beliefs match their behaviors? So if they say, we believe that our staff should be supported with their mental health, what are you doing to essentially support that? So there's questions in there, for example, do you value your employees' mental health? And then the next question might be, what mental health resources or supports do you provide to your staff? So it would kind of help eliminate some of that dissonance if they believe that they should support their staff's mental health, but they're not taking action to do so. So that hasn't been rolled out yet, but we're hoping to offer those in person and virtually in terms of how the businesses can fill those out. I'm also creating an anonymous survey for Richland County employees. So this would be sort of the employee perspective on, does my employer provide mental health resources? Do I feel supported by them? Just to kind of give us another perspective on that. So overall, the purpose of the surveys is just to better understand the role that businesses and employers play in the mental health of the county, and then to identify opportunities for intervention and support. So if we notice that if a business is very open to offering mental health first aid, then that's something that we could pursue. And then The hope is really to get everyone on the same page with, so that if I go to a business in town, they're going to be on the same page with mental health and substance misuse, stigma, and essentially, if every business in the county was on board with that, then hopefully that would improve the mental health and those substance misuse behaviors too. And then we're working with the Richland Hospital and their CHIP action plan. So we're trying to make connections with them to promote the network of care. So that's a website where you can access all the mental health resources for the area. They have a map where you can click on Richland County and it'll list off all the resources. So the goal there is to help people get connected to the right resources so that they're not utilizing crisis care every time they have a mental health struggle or challenge. And then they also are working on a referral pathway. So Southwest CAP has community health workers, and they're trying to work on a pathway where patients can be referred to those community health workers to help them get in touch with the mental health services they need. You can go to the last slide here. So moving forward, these are some things that we're going to be working on here in the future. Work groups will continue to meet one time per month. We're generally meeting towards the end of the month. We're going to try to address social hosting. So that's when parents are supplying youth with alcohol, either in their home or not sure how often it's occurring at bars, but I know that it can. And then working with local event organizers to provide those festival toolkits. So I know Betsy Raisler with Partners for Prevention, that's something that they're working on and, as part of our collaborative. And really developing a unified community message around stigma. So that's where I think if we have all of those businesses on board, we can create that unified message within the community. And then overall trying to increase and improve that access and awareness of mental health services. I think the network of care is a great way to do that. And so we're trying to promote that. And then facilitating those community-wide mental health trainings and educational programming. So the hospital does Safe Talk. There's a few others, but the mental health first aid, the COMET training, some of you may be familiar with as well. So looking to see if any businesses might be interested in incentivizing their staff to offer those trainings. So that's kind of a overarching look at what we're doing with our CHIP work, and happy to answer any questions that you have.
Just knowing that the fair is coming up,
Yeah.
it's an event at which the last number of years they have been using alcohol sales as sort of to supplement the income, I guess, of the fair.
Yeah.
Have you been asked to provide or present the toolkits to the fair committee or the vendors there that provide the alcohol?
Yeah, so we haven't been asked, I don't think directly by them, but in our last alcohol work group meeting, we did talk about, I know Betsy was going to reach out to, there was a group that meets, and I believe a lot of the festival, the event organizers were going to be there, and we did talk about offering presentations to them on the toolkit. We kind of had the unique situation with the Boaz Village where they had reached out to us for the signs, which is awesome. So the toolkit describes all of the best practices, and hopefully we can provide some education to the organizers, and they'll let us, or they'll implement those strategies.
It would be nice if the two county organizations would work together
Yeah.
towards healthier objectives.
Yeah, no doubt. I know it's definitely on our radar though, for sure.
How are you distributing the mental health surveys to the businesses?
For the businesses, so we had talked about, I know Betsy and Linda offered to deliver in person, so just going to the business and trying to see if someone would take time to fill it out, just kind of them dropping in. We also discussed calling in advance to try to set up a meeting if we did it in person. And then the other route would be maybe calling and seeing if we could send it virtually as well. So as a group, I sent it to the group. Once they all approve all of the questions in there, then Betsy and Linda are going to try to complete those in-person ones. Linda wanted to offer it to a small business and a large, and I think Betsy was hoping to offer the interview to Rockwell Automation. So that's kind of our plan as of right now for the rollout on those. The anonymous one to the employees, I'm trying to figure out a way to incentivize that and keep it anonymous. So I think we would get better participation if it was anonymous, but I haven't sent that out yet to the group, so that one's kind of maybe a little bit behind in comparison to the one for the businesses.
Would there be a way to make it like available online for, filling it out online and submitting it? So if there were other people that aren't part of those certain businesses that would like to participate?
Yeah, I think we probably could do a QR code on like a flyer, maybe on our Facebook page. The survey itself I created in Google Forms, so that's already created virtually. I think just the distribution, we could probably do a QR code and get that going.
Questions, anyone else? Well, thank you very
Yeah,
much.
thank you so much. Appreciate it.
Excellent. Did you have any? Okay, any questions for Tricia? All right, then we'll move to B and C, our budget. So HHS expenditures report. Stephanie, I see you're online. Tricia tells me you're on vacation and still dropping in. So that's dedication. Thank you.
No problem. Just in case there was a random strange question, although I have to say, listening to the pre-conversation, I saw mountains on day one, but now it's all covered in smoke from forest
Oh, are you in
fires.
Tennessee?
I am in Cheyenne. Actually, I'm in Wyoming. So right now I'm sitting at a
Oh.
truck stop in Cheyenne because I have no cell service. But I did see elk, Trish, but no bear. So we just kind of flipped that a little bit. So
Nice.
yeah, but
Well, there were, so 7B's in your packet, the expenditures report. Did anyone have any questions on that portion of it? All right, and then 7C is our budget. Stephanie, I don't know if you even have access. Did you have any comments on that at all?
Sure. So the 2024 budget so far, we should be at about 50%. That's through the end of June. You might see a couple of lines that are above that 50%. You said there's a staff issue. Some of them are a little bit higher. Staff or administrative services. My guess is that is, well, June was a 3 paycheck month. So some of these lines are a little bit higher because of that. Public, also in June, I believe one of our insurances hit, like workman's comp or something like that. Public health is a little bit higher. That's because we're starting to spend some of that ARPA money that wasn't budgeted. We had that $350,000 that we had to do a spending plan on. So we're going to start seeing some of those expenses in there. So that's just going to make it look higher, but just know that we got ARPA revenue coming in. And then if you jump down to CCS, that's over 50%. But again, increased services, I think they've reported that the CCS enrollment's increasing. So you're just going to see increases there. But overall, the budget is below the 40%. And our core budget balance is looking decent at this time. As far as placements, the adult placement fund, Fund 54, is only at 21% utilization. You'll note that we've had quite a few placements as far as the number of people, but we've been able to get reimbursement through certain age groups can get reimbursed. They'll get paid for through insurance and Medicaid. So certain age groups. So we've been good there. For the adults, children's is slightly under 50%. That's going to probably trend there for the whole year. We have you saw, I think later we have a contract coming that we had to increase. So when you see that, you'll know why that's probably going to be steady through the rest of the year and stay high. So that's all I have for those. If anybody has any questions.
Great to me. Any questions, anyone? No. Okay, I think what is going to be new for us is D, 2025 budget overview. Will that be Stephanie? You're gonna be going over it, Stephanie? Okay.
Well, I'll start it, and I'm sure Trish will pitch in. I'm sure she'll share. So sure. So we created our 2025 budget. You can see it's proposed. This is what we submitted to the powers that be last Tuesday already. It was. So this is what we submitted. This includes the wage increase that we were given the directive to use, and well as insurance numbers to use. So that includes this, is included in these numbers. So some of the increases are more than likely due to the wage and insurance increases. So like administration, you'll see an increase. Public health, you'll see an increase. Public health tax levy, you're probably, I'll talk about tax levy later, sorry. Aging and Disability Resource Center. One thing you'll notice on here, if you compare it to years past, is I've combined Fund 59 with Fund 63. And I don't know how much everybody knows about each individual fund, but Fund 59 is used to be pulled out for the nutrition program. So we combined that into one elderly services fund. So that's all in there now. It just gave us the ability to be a little bit more flexible with using certain match dollars to move that around that way. So that's a good change there. Otherwise, the ADRC, the Resource Center Fund, is staying the same. Economic support, slight increase there. Child and Youth Services, you'll see there's an overall increase ask of about 51,000, almost 52,000. As my brain's trying to recollect, we received additional funding through what's called Family First. So there's that. And then we also included some reunification and prevention dollars. Is that right, Trish? I can't remember what the two lines were.
That's correct.
Okay. Yeah, so we added, increased that, but we had some funding to back that up. So it shows increase, but as you can see, no tax levy. And then behavioral health is all of our crisis, mental health, outpatient, AODA, all of those programs, birth to 3 children with disabilities. If you go to the far right for the differences there, you'll see slight increases, a large increase in AODA outpatient. That is due to us, the creation of a position. We created a position and we're able to use grant funding for that position. So that'll be covered by grant funding across 3 different grants, the SOAR grant, I believe the TAG grant, and then we also have the MAT grant, which is Medicaid assisted treatment for individuals in the jail. And then of course CCS, just the services are increasing there, but you'll see no levy. At the end of the day, we did ask for an increase of $202,032 in levy. Fund 63 now includes nutrition, meal prices, meal costs are going up, increasing. So we asked for an additional $27,922 in levy in that program. And then for Fund 56, if you, a couple of different factors, and Trish, you can fill in if I'm forgetting something, but we're not getting ARPA funding anymore. So some of that funding was used in the public health department. So we had to ask for an increase there. And just in general, some of the, administration, that's tax levy, that increase there. Again, public health, that's there. Let's see, and then behavioral health services, I think, this budget too, also Trish, I believe this budget, it was, we had to, if you look at mental health outpatient, that was also where we budgeted for a contracted therapist. So that's in there. So that was going to have to, in order for us to pay for that position, the levy had to get moved around from other places, if that even makes any sense. But yeah, so so that's what we presented. No increase in placement funds at all. We kept that status quo. And yeah, so that's the budget presented and proposed. And I guess now we wait and see what they tell us. They're going to plug all the numbers in for all the different departments, and we'll see what shakes out at the end. Trish, do you want to add anything?
I think for child and youth services, like one of the things Stephanie said is we did add in a line for prevention services and for reunification services. We've had lots of discussions in the last year or two since I've been there. We haven't budgeted for that. So in our children's unit, we budget for the placements and we budget for staff, but we don't really budget for services for families. And so we're really hoping with building in some of those funds that we can be proactive and keep kids out of placement and get them home sooner. It's funny, the state gives us money to return children, and I understand that, that completely makes sense. But if we can't control for safety with them in the home, the state doesn't give us extra money for that. So we need to build in some money for when the kids are unsafe to get them to safety. And so that's what we're working to do with adding those 2 lines there. The other thing is there was a huge increase to public health for all of our ARPA monies done at the end of this year. And so to really continue with the services that we do need to build in those extra funds. And as Stephanie said, we do have a contracted mental health therapist built in. We have hired someone. Our hope is that she'll stay with us forever. But if we need to go back to contracted to keep our license current with the state, we did leave those funds in there.
Great. It's a lot of information. Any specific questions? Just to kind of recap again, we did not increase any placement funds for children or youth placements. Just increased in our core budget, and the increase in tax levies down there at the bottom, it's that 202,000. But correct me if I'm wrong, Stephanie, that increase includes all of the wage increases and insurance as well.
Correct, yes,
Okay. And as well
Perfect.
as all the other things you guys highlighted.
correct.
Does that make sense to everyone? Anyone have questions? This is a little bit of a tangent, but when you were speaking of the child and youth services and including those, what does that look like, the prevention part of it? I know that's a bit of a tangent, but.
So it could be things like getting a psychological assessment done on a parent so that we have an idea of what are their mental health needs and how do we best serve them. It could be getting a anger management assessment. It could be if there's concerns that the home conditions are unsafe, helping them to make their home safe. So it's looking at those types of services. Sometimes it's even just saying, you know, if a family's like, I can manage better if I have some supports as far as mental health. We're working on getting enrolled in mental health therapy, but it'll be 3 months before our insurance kicks in, or we can't cover the copay for that, and it might be covering some of those services.
Okay.
The goal really with that is that our placement budget decreases. I know it's not going to come right away, but the hope is over the next 3 years that we can then decrease the children's placement budget.
Thank you, guys. Thank you for presenting that, Stephanie.
Thank you.
I think that all the stuff we need from you. I hope you can enjoy the rest of your vacation. Thank you.
Yeah, thank you. Bye, everybody.
Bye. All right, so that takes us to 7E, child support and admin report. Do we have anyone here? Oh, hi.
Hi, how's it going?
Good, how are you?
Good. All right. I'm Melanie Walters from the Child Support Agency. So I had included some packet information for you. You had decided at a previous meeting that we were only going to report quarterly. So this is our report through the end of June, because obviously July just ended, so we don't have those numbers yet. Every month we get performance measures based on paternity, court orders, support collection, and arrears collection. The ones you see up there in green, we have met our benchmarks every month on those. The arrears collection, we have not met yet. We're pretty close, about 1.5% away. We're currently 12th for arrears, and there are only 6 out of the counties and tribal agencies who have met the benchmark. That's the one that every year come October 1st, the slate is wiped clean and you start at 0% and build your way back up. So as we get closer to our October 1st deadline, when our federal fiscal year ends, we're hoping that we hit that 80% mark. So we are on target to do that right now. We have been diligently working on training in our office. I have been doing some training on intergovernmental cases. Those are cases that we work with other states. They either send their orders to us or we send our orders to them when the non-custodial parent, the payer, is living in a different state. So I have completed all of my training for that. I attended a roundtable recently on it. Our next thing we're going to be looking at getting additional training on is enforcement measures. Sauk County's director has very graciously offered to provide our agency some training with that. So I'm working with her on kind of seeing what that's going to look like. Is that where one of us travels to their agency, one of their workers comes here, we do it virtually? So that currently is in the works, and I've been working with Administrator Pesh on kind of hashing out the details for that. And then we do have our annual Child Support Enforcement Conference in October. Charlene and I are both signed up to attend that. That is a wonderful resource, not only for learning any updated guidelines, but it's a great networking resource, especially for us as a small agency. We're only 2 people, to make great connections with some of the other agencies that maybe have more experienced workers, and then they can kind of provide us some mentorship if we need to, or guidance in areas that maybe we're not up to speed on yet. I provided our budget reports as of the end of June. For our state aid revenue, I will notate that as of yesterday, we did receive our second payment. It's just a little over $41,000. So that is our second quarter payment. So that puts us on track. So that'll be notated the next time I come to the meeting for our updated report. Otherwise, the rest of our revenue is pretty much on track for what we're expecting it to be. For our expenditures, as of June 30th, we have only utilized 37% of our total budget. Some things to notate where we're seeing some cost savings, salaries and benefits are the big thing. The salary that was budgeted, obviously our former director, her salary was different than, me coming back as a caseworker. So we're seeing a cost savings there. We are currently seeing a cost savings on the health insurance, because I currently do not take health insurance through the county. And then we had budgeted for contracted services. And at this time, the only thing that we may be looking at utilizing that for is if we end up with a contract with Sauk County to provide us some training. Otherwise, we have not utilized any of those funds. We do have a couple items that we are over right now. One of them is a small amount of overtime. That is from myself. When I first came back, I was putting in some additional hours just to try to take care of the backlog in our office because we were very short staffed. And then, of course, with turnover in the office, we had additional advertising costs. And then with the departure of our former director, we had unemployment that we're paying out that we didn't budget for, but we do have the funds in other line items that will cover that. Amy Forehand is our interim director. She is currently has worked on our draft budget for 2025 and turned that in. And I did meet with Candace and Larry the other day, and they kind of showed it to me just so there's somebody else in the agency that's kind of in the loop on it. And we just talked about some different things on that, and we'll be meeting again. The plan is to have Amy Forehand, myself, Larry, Candace, and Tammy Wheelock, the accounting supervisor, to all meet and kind of try to get a finalized budget for our agency done. So, and then the last thing is not on there because I just got the information this morning to let you guys know. August is Child Support Awareness Month. Governor Evers has actually issued a proclamation that August is Child Support Awareness Month. And for 2023, for the state of Wisconsin, there were $841 million in child support funds collected. 98% of that went to families, which served 341,000 children in the state of Wisconsin. So those are very impressive numbers. So, and that is my report. And if you guys have any questions, I would be happy to answer them.
Thank you, Melanie. I have a question on the second form that's in there. It's the public charges for services. These forms confuse me a little bit. So
Okay.
this $750, is that for annual budget? Because then it looks like you're almost at that already.
So these are projected, this is, revenue that
Oh,
we
it's-
are projected to get yet.
Revenue,
This is kind
okay,
of our miscellaneous, so, we project, because, so service fees, genetic testing and other court costs, we can actually incorporate into a court order
okay.
to have the participants
To
repay.
charge,
And
okay,
then that is where that money is deposited back into, so we kind of just make a generalization each year of, based on the past so many years, this is what we estimate we will probably be putting through on court orders to get
Okay.
back as revenue. So we actually, like the one that says that we received $20 and we budgeted you would get nothing, that's just, it looks like miscellaneous court costs, so there must have been something in a court order that we charged and then we got paid back for.
okay,
Yeah, so this one's actually revenue.
okay, so, perfect. Yeah, oh yeah, it says revenue at the top,
That's okay.
see that. That was my question, anyone else? All right, thank you,
Thank
Melanie.
you very much.
Okay, we are moving on then to 8, contract approvals.
All right, so we have 2 new contracts to present to you today. First one is for Bluff and Ridge Assisted Equine Therapy. This is for our Children's Long-Term Support Program. So this is a service that a family has requested. This is not, tax levy is not used to fund that service. And same with the Chilita Institute. It's again a service that a family has requested for the Children's Long-Term Support Program, and program funds will cover those. Those are 2 new contracts that we're asking for your approval on.
Any questions on those? Otherwise, we would need a motion to approve those 2. Making a motion, Supervisor Brewer? Okay, so we have a motion, second by Ms. Kramer. Any further discussion or questions?
Where is this Bluff and Ridge equine located?
Looks like it's in Kendall, Wisconsin.
Is it
I don't know where that is.
It's in Monroe County.
a little ways up there?
Yeah,
We do have a family that transferred to us from another county, so it's possible that that's one that we're trying to,
Sure.
because they're able to keep their same services.
okay.
Don't know if they do donkeys there. They should.
They should, but I know there's one in Laval. She does PTSD therapies with veterans and anybody else. And she has a mixed podge of different animals, but this is probably, you're right, so this person here could have the same animal. Because they probably got a bond. So it's, you don't want to break that. Yeah.
You ready to vote? All those in favor of these 2 contracts, please say aye. Any opposed? Okay, so then the next one.
The next one is a contract amendment, and I will have Kayla talk about that because it is for her.
Okay, so we have a current contract right now with Forward Home for Boys. It is a local group home that we have. We currently have 3 youth that are placed there. One of the youth that we had to approve for additional funds to cover because he was he had a lot of needs. However, now we are moving him back with grandma. So it's going to be a little less.
So yeah, we'd still be asking for the
Yep.
same amount. At the time that we drafted this, we did have 3 placements there. We're down to 2, but it is possible that he may need to go back or that
Yes.
he may need somebody else there.
Yes.
So I'm confused by the wording because this says due to placement of 2 additional children.
So when we first did the contract at the start of this year, we had 1 child placed at Forward Home for Boys. Since the start of 2024, we've placed 2 additional children
We
there.
hadn't amended it yet?
Correct.
Okay.
Correct. I think they were both placed, one in May and one in June.
I think so.
What was our original? Oh, it says it right there, 150. Okay. All right. Questions on that? Otherwise, we'll take a motion for that. anyone? Thank you, Ms. Kramer. Do we have a second? All right, Michelle. And any further discussion or questions? Otherwise, we'll vote. All those in favor of approving the contract or amended contract for Forward Home for Boys, please say aye. Any opposed? Okay. Takes care of our contracts. Thank you.
Thank you.
Number 9, discussion and possible action, creation of an economic support supervisor position.
I will let Brianna take the lead.
Hi, Brianna.
So to give a little background, Richland County is part of an 8-county consortium that includes Adams, Columbia, Dane, Dodge, Juneau, Sauk, Sheboygan, and us. So that means we all work together to provide the public assistance eligibility determination for those 8 counties. In 2015, the consortium was given funding to create more positions. And since Richland was paid the least, the positions came here. And so we were able to get 8 workers and 1 lead. So now we are up to 13 workers, 1 lead and 1 manager. The lead does, part of being the consortium is the lead has to give time to do consortium work. So the lead spends at least half doing duties that are assigned to them from the consortium. That includes 4 hours, 2 to 3 days a week, 4 hours each day on a telephone help queue for workers, so workers can call in and ask their questions. And then the other days, he gets a list of absent workers that he has to do their work specifically for them. Due to the high volume of work, that has been taking all day to do those. So currently, the lead is also handling some supervisory duties to assist me and cover for me if I'm gone. Examples are approving and denying time off requests, informing workers of complaints, and then some disciplinary recommendations. The issue is that the workers do not directly report to the lead worker. It's supposed to be more of a peer-to-peer relationship, and adding that supervisory component into at least a difficult relationship. So, yeah, and in other counties, the leads are not part of the supervisory. And then the way things are, I'm unable to regularly perform managerial duties expected of me. And the examples are updating and writing the unit policies, the ES unit policies. Most were written before our previous manager. So I think when our maybe manager before that was on her way out, she retired. She wrote a lot of policies. So a lot of them can be archived, and I really haven't had a chance to go through them. I've written a few, and that was because changes to the structure of our unit. And then I have not been able to do like the deep dive monitoring of staff. So that includes 5 systems that I have to pull up information from and just compare them to make sure that the workers are working to the best. This is necessary to catch any correct actions before they become bad habits. So we're trying to help the workers to do the best they can. And at this point, it's more of a reactive thing where I hear of a problem and then I go in and do it. It's for the fact. And then I have not been able to really focus on the big picture of the unit, including the budget, and that's county and consortium. So the new supervisor position will have the authority to ES lead, and that would then relieve the ES lead of that uncomfortable supervisory component of the relationship with the lead, with the ESS, the workers. And then the position will handle the day-to-day operations of the unit, including QC work. And then that will forget to look at the big picture, assuring the unit is meeting state consortium contract obligations. And then I'll also be able to focus on performance evaluations and ensuring workers are doing the best work possible.
So one of the things, since I've started, Brianna and I have had lots of talks about our unit and kind of how things run. And I've also had concerns brought to me by some of the staff. So one of the concerns brought by staff is there's just not enough support when they're training, when they're new, and staff are almost responsible in a way to do some of that hands-on training and education. Our hope with building in the supervisor position is that supervisor, because they won't have the consortium duties that lock them to their desk and lock them to the consortium, they can really be focused on training. So right now, when our on-call worker's in, they're sitting with the new worker. Our hope is that the supervisor then is taking that time, sitting with the new worker, doing that training. And be available all the time for questions, because right now they're not, because they have those consortium duties that they have to do. So that's one of the things we're looking to do. It's also when she talks about the, that in real time. So the consortium has staff that watch in real time what's happening with the call center. So if, you know, worker Jane is been inactive for a long period of time, they're emailing Brianna and Darren and saying, hey, Jane's been inactive, somebody needs to check on her. With Darren being the lead, that puts him in an awkward position because then he has to go to Jane and say, hey, you're not working, what's going on, what are you doing, where are you at with that? This unit also has both in the office workers and remote workers. And so it's not just as simple as walking down the hall and seeing it, it's really picking up the phone, calling the worker, trying to figure out what's going on.
What's the ratio on remote to
About half.
in-house?
So we're looking at the same as we did the recovery services position last month. We want to bring it to you. We want to make sure that you are okay with continuing to support our process and trying to get this built into our budget. There would be no additional levy. With our consortium budget, we have a maintenance of effort that we are required to cover. It's that minimum dollar amount. The rest is covered by the consortium. We would also be removing one of the workers and building in the supervisor. So that really is helping with making sure we're staying within that budget and not having to use any money.
Does this budget or this recommendation have to go beyond this committee and the Richland County Board? Does it have to go to a consortium
No,
board? No. They just trust us to do the job.
correct, yeah. Each county is their own entity, but they all come together then to.
Right.
So the amount that we get is based off of our percentage of people that we serve. And so we are able to do that with that percentage that we get.
I just need to respectfully ask to leave because I have another.
Thank you, Cindy. With our budget, when you guys mentioned increases, does that include the economic support workers? Are they included in that budget of like our wages and increase?
Yes.
Will that put us any closer to some of the other counties and what they're paying their no?
Several of the counties are going through
Wage stays, right?
Okay,
I believe we are still the lowest paid, but not as bad as that.
Yes.
historically, have you guys had issues filling positions though? It seems like you typically are able to fill the positions, right? Okay.
And we've had some great new hires. I mean, we really have. We've been very lucky with the workers that we've been getting.
Do they get a wage increase if they're bilingual?
Yes.
How
75
much of
cents.
75 cents an hour? Yeah.
We have one.
So we have one in economic support and one in behavioral health.
Okay.
One of our CLTS work to 360S workers is bilingual.
Do you know, sorry, I'm really getting off on a tangent here, but do you know if the wage study is also looking at that? Like what other counties do for, I'm just curious, because
I don't know.
I know I've had it mentioned to me that doesn't seem like much of an increase for being able to do that extra work of translating. So I'm just a little curious as to how other counties reimburse. Anyways, that was an aside. I appreciate your explanation of this. This looks good to me. Does anyone have any questions or issues?
This is probably not a big money maker for the Richland County. However, it does provide employment to, how large is 11, what's it?
There's 15 of us.
15 almost, so. And I assume many of them county was.
Correct, yes. And that was the good piece of all those positions coming here is that we were able to offer
Right.
Richland County workers positions versus King County where the jobs are plentiful.
Okay, it's a good thing.
All right. We'll need a motion to approve sending this on. Thank you. Do I have a second? Ms. Miller, okay.
Excuse me, I'm sorry, I missed who was first.
Michelle Hart,
And Mary.
yes. Any further discussion? We still have quorum, right? Yes, we do. Okay. So all those in favor of sending this on, I believe it'll go to finance, correct? Or does it go straight to them?
No, it'll go to finance and personnel once we get a full job description,
Right,
because we're waiting for,
the wage study.
yes. the
Okay.
wage study.
We're also waiting on that for the other ones.
Yes,
Okay.
yes, yes.
All those? Any opposed? Okay, that takes us to correspondence. Do we have any correspondence? Thank you very much. Any future agenda items? Yeah, there you are, Mara.
So we will bring the, our ARPA spending plan back to you. You guys requested that we present that quarterly to show that, you know, kind of where the money's going and how we're spending it. And then we'll do our contract monitoring report next month too.
Okay. The ARPA money you mentioned, it has to be done by the end of this year, right? Okay.
Yes.
Okay. Anyone else? All right, thank you all very much. I will take a motion to adjourn then to our September meeting, which will be September 5th. Thank you, Mr. Brewer. Do I have a second? Thank you, Francis. All those in favor, please say aye. Okay. Opposed? Yes, 9:30. We are sticking with that time. Thank you all again. This meeting will be adjourned.
Supposed to be thing.
Oh,
But.
what? Okay.
Sweet.
Oh.